Did you know that some of the earliest warning signs of kidney failure can appear far away from your kidneys themselves? Not in your back, not in your urine, but in your feet. This surprises many people. Most adults believe that as long as they are urinating normally, their kidneys must be fine. They assume kidney failure always announces itself loudly. The truth is far more concerning. Kidney disease is often quiet, slow, and deceptive. Millions of people are walking around today with damaged kidneys and have absolutely no idea. In fact, in the United States alone, more than 35 million adults are living with chronic kidney disease, and many of them will not discover it until the damage is already advanced. 1 in 3 adults is currently at risk. Why does this happen? Because kidney failure does not always cause pain. It does not always reduce urine output, and it does not always make you feel sick right away. Many patients tell doctors the same thing. I can't have kidney disease, I urinate just fine. But normal urine volume does not guarantee healthy kidneys. Some patients who eventually require dialysis were still producing large amounts of urine right up until the moment their kidneys failed. This is why kidney disease is often described as silent and sneaky. And this is also why paying attention to subtle physical changes matters so much. One of the most overlooked places where kidney disease can reveal itself is the feet. It sounds unusual, but medically, it makes perfect sense. The kidneys play a role in fluid balance, toxin removal, bone health, nerve function, blood circulation, and hormone regulation. When they begin to fail, the effects travel throughout the body, and the feet, being far from the heart and highly sensitive to circulation, nerve changes and fluid shifts often show the earliest clues. Today, we are going to discuss 7 serious ways your feet may be signaling kidney trouble. These signs are not meant to scare you, they are meant to inform you. Early detection can slow kidney damage. In some cases, it can even prevent the need for dialysis or transplant. Many patients already on dialysis say the same thing. I wish I had known earlier. I wish I had recognized the warning signs sooner. That regret is exactly what this video is designed to prevent. Let's begin. Warning, sign 1, swelling of the feet and ankles. Edema, foot and ankle swelling is one of the most common but most misunderstood signs of kidney disease. Your kidneys help regulate fluid and sodium balance in your body. When they are not functioning properly, excess fluid can accumulate instead of being eliminated. Gravity pulls that fluid downward. The result? Swollen feet, puffy ankles, shoes that feel tight by evening, sock marks left behind on the skin. Some people dismiss this swelling as just aging or being on their feet too long. But persistent swelling, especially swelling that worsens as the day goes on, deserves medical attention. A simple self-check can offer clues. Press your finger gently into the skin of your foot or ankle for several seconds. If an indentation remains after you remove your finger, this is known as pitting edema. Pitting edema is not normal. It can signal that your body is retaining fluid due to kidney dysfunction. Some people notice that their feet look normal in the morning but swell later in the day. This does not rule out kidney disease. In fact, it often reinforces the concern. If swelling is recurring, progressive, or unexplained, it should never be ignored. Warning sign 2, numbness, tingling, or burning sensations. Another subtle but serious sign involves changes in sensation. Kidney disease can lead to a buildup of toxins in the bloodstream, a condition sometimes referred to as uremia. These toxins can irritate and damage nerves over time. When nerve function is affected, symptoms often begin in the feet. You may experience tingling, numbness, burning sensations, reduced sensitivity, or even complete loss of feeling. This condition is known as peripheral neuropathy. Neuropathy is dangerous not only because it feels uncomfortable, but because it reduces protective sensation. A person with numb feet may step on something sharp and never realize it. Small injuries can go unnoticed. Infections can develop silently. Healing may be delayed. This combination significantly increases the risk of serious foot complications. If numbness or tingling appears without an obvious explanation, kidney health should be evaluated. Warning. Sign 3, persistent foot pain or deep bone discomfort. Foot pain has many possible causes. shoes, overuse, minor injuries. But kidney disease introduces additional, less obvious causes. Few people realize that the kidneys play a critical role in maintaining healthy bones. They regulate calcium, phosphorus, vitamin D, and parathyroid hormone. When kidney function declines, these systems can become unbalanced. Over time, this can lead to a condition known as renal bone disease. Bones may weaken, structure may deteriorate, pain may develop, sometimes deep within the feet. Another important connection involves gout. The kidneys normally remove uric acid from the blood. When kidney function declines, uric acid levels rise. This excess uric acid can crystallize in joints, particularly the big toe. The result is sudden, severe pain, often mistaken for an isolated joint problem. But gout flares can be a warning sign that the kidneys are struggling to do their job. If foot pain is recurrent, unexplained, or severe, kidney health should be part of the conversation. Warning sign 4, changes in skin color of the feet. Skin color changes are powerful clinical clues. Poor kidney function often goes hand in hand with vascular disease. Conditions such as diabetes and high blood pressure damage blood vessels throughout the body, including those supplying the feet. When arterial circulation is reduced, oxygen delivery decreases. This may cause the feet or toes to appear pale bluish or unusually cold. In severe cases, prolonged lack of oxygen can lead to tissue death known as gangrene. Darkened or blackened skin is a medical emergency. Venous circulation problems can also occur. When blood struggles to return to the heart efficiently, fluid can pool in the lower legs. This may cause redness, dark patches, or thickened skin. Additionally, electrolyte imbalances and chronic itching can lead to skin irritation and discoloration. Changes in foot color should never be brushed aside as cosmetic. They often reflect deeper systemic problems. As we continue, it is important to understand one key principle. Kidney disease rarely announces itself with just one symptom. Instead, it reveals itself through patterns, small changes that appear unrelated, signals that are easy to dismiss, discomforts that feel minor until they are not. The feet often reflect these patterns early because they depend heavily on circulation, nerve health, skin integrity, and proper fluid balance. Now let's continue with the remaining warning signs. Warning sign 5, dry, itchy feet and ankles. Dry, itchy skin may seem like a harmless inconvenience. Many people assume it is caused by weather, soap, or aging skin, but persistent itching, especially in the feet and ankles, can be a sign of kidney dysfunction. Healthy kidneys remove waste products and excess electrolytes from the bloodstream. When kidney function declines, certain substances begin to accumulate. One of the most important is phosphorus. Elevated phosphorus levels are strongly associated with intense itching. Patients often describe it as relentless. Scratching does not bring relief. Skin becomes irritated, discoloration and thickening may develop. In advanced cases, itching can interfere with sleep and daily comfort. Kidney disease can also disrupt vitamin balance and hydration of the skin. This contributes to dryness, cracking, and increased vulnerability to infection. While moisturizing and gentle skincare are helpful, they do not address the underlying cause. If itching is persistent, widespread, or unexplained, it is essential to investigate kidney health. Warning: Sign 6, foot ulcers and poor wound healing. One of the most serious warning signs involves wounds that do not heal properly. Kidney disease is closely associated with poor circulation, nerve damage, and immune dysfunction. Together, these factors create the perfect environment for chronic foot problems. Small cuts may take weeks to heal, blisters may turn into open sores, minor injuries may progress into ulcers, poor venous circulation can cause ulcers near the ankles, poor arterial circulation can reduce blood flow to the toes, leading to pain, discoloration, and tissue breakdown. Neuropathy adds another layer of risk. When sensation is reduced, injuries may go unnoticed. A person may not feel pain, they may not see the wound. Infection can develop silently. In severe cases, untreated foot ulcers can lead to systemic infection or even amputation. This is why regular foot inspection is essential, especially for individuals with diabetes or known kidney disease. Delayed healing is never normal. It is a warning. Warning sign. 7. Restless leg syndrome. The final warning sign is often one of the most frustrating. Restless leg syndrome creates an uncomfortable urge to move the legs, especially during rest. Patients describe sensations such as crawling, tingling, burning, pulling, deep discomfort. Symptoms typically worsen at night or during prolonged sitting. Sleep becomes difficult, rest feels impossible. Restless leg syndrome is strongly associated with chronic kidney disease. The exact cause is not fully understood, but several contributing factors are common in kidney patients: iron deficiency anemia low, erythropoietin levels, toxin accumulation. Erythropoietin is a hormone produced by the kidneys that helps regulate red blood cell production. When kidney function declines, anemia develops. This contributes to nerve irritation and restless sensations. Restless leg syndrome should never be ignored, especially when combined with other warning signs. Why early detection matters: kidney disease does not have to progress rapidly. When detected early, progression can often be slowed. In some cases, kidney damage can even be partially reversed. Early intervention may include blood pressure control, blood sugar management, medication adjustments, dietary changes, monitoring electrolyte balance. Most importantly, early detection may prevent or delay the need for dialysis or transplant. Many patients wish they had recognized the warning signs sooner. Awareness changes outcomes. What you should do if you notice these signs. If you experience any of the following: persistent foot swelling, numbness or tingling, unexplained foot pain, changes in skin color, severe itching, poor wound healing, restless legs, do not dismiss them. Consult a healthcare professional. Ask about kidney function testing. Simple blood and urine tests can provide valuable information. Being proactive is not fear, it is empowerment. Your feet are not just tools for walking, they are messengers. They reflect what is happening deep inside your body. Listening to them may protect your future health. Early detection saves kidneys. Early action saves lives. If this information has been helpful, share it with someone who may need it. Awareness grows when knowledge is shared. And remember, your health journey deserves attention, clarity, and care.